Thank you so much. Welcome everyone to the panel. I'm sorry my voice has been like this for over a month, but I promise I'll try my best to keep it in check. If you're born in the late 1800s, early 1900s, you have lived to a life of 40 years. Fast forward now, life expectancy close to 85. If I borrow the Andrew Scott, the 100-year life, that's sort of the life we're expecting. Longevity is a reality among us. How do we now think about not just an increase in lifespan, but actually in a better, healthy life is what we're really discussing today. And we're gonna zoom a little bit more into the scientific side of it. Sorry, Shaista, you've set the stage amazingly well by borrowing a lot of the things I wanted to talk about, and setting the stage is wonderful. And thank you so much for this. I would love to sort of set the stage by asking all three of you different perspectives of that longevity. So if I start with you, Shaista, PureHealth, and I love the slogan of this sort of starting off by talking about the science of longevity as a sub-component to this. This is a very unique integrated model of healthcare. To what extent is this new model, you talk a lot about access, the future of access, how do we revolutionize the way we do healthcare? To what extent do you think PureHealth's model of that is starting to think about this new health experience of our patients? How does that contribute to that promise of longevity?
Thank you, Mona. And I'm sorry if I took away a lot of your opening remarks. We should have coordinated before. So, but then, you know, you're spot on when you said longevity is not just lifespan, it's health span. There is a misconstruction on what people understand about longevity. Whenever you ask someone, and this is one of my favorite questions, when I ask them, what is longevity, I get different answers, even from healthcare professionals. So everyone has their own perspective, and I respect everybody's opinion, but I'll tell you what PureHealth thinks about longevity. So longevity is not just increasing your life on this planet. Longevity is, so we've got, if you've got a graph, a linear graph, and you've got the y-axis on, you know, the lifespan, where longevity is about increasing the quality of life as much as we can, so that we can spend additional years in a good health span, which will automatically result in a longer lifespan. So that's for us longevity. Because you could live up to be 101, but there's no point if the last 10, 15 years of your life are bedridden, really. And that's what's happening. If you look at it historically, the lifespan is increasing, but so is the sick span before mortality. That's increasing as well. So it's not going towards a health span. Now, how do we feel that we're perfectly positioned? So within all of that area, which we're trying to square, PureHealth is in a unique position because we understand not just traditional healthcare operations, which is more prone to deliver reactive care, but we understand how to deliver proactive, preventive care as well, whether it's through research and technology, and I'm sure Fatima here is going to tell you a lot more about some of the things that we're doing, whether it's digital diagnostics or interventions. We've actually married both of these together, and we're trying to take healthcare to that next level. You cannot achieve longevity without digital intervention, without technological innovation. It's as simple as that. Also, one more thing I'll add before I sign out, longevity is actually quite simple. People tend to complicate it. You know, you could get, we were just talking about this before the panel, hyperbaric oxygen chambers and this and this. Longevity at its core is understanding your genome, understanding what you are made of, so that you can live your life to the fullest. So if you are a Ferrari, then you have the potential to go at maybe, I'm not a car fan, but 500 or 400 kilometers per hour, I don't know. But if you're a Nissan Patrol, you are designed for something else. You can do great in the desert. But first understand your makeup. What are you made of? And then design your healthcare journey accordingly. Thank you.
Thank you so much, Shaista. I think you bring up some important points that Dr. Farida, I think you're best fit to answer. I mean, the UAE has been on the forefront of stem cell research, lately on the genomic projects of which you're a big part of. I was wondering if we can give a little bit of a glimpse of how, from a stem cell research, from regenerative sort of disease and thinking, what are some of the breakthroughs that you're starting to manifest in the context of the UAE? And how does this contribute to that longevity question?
Thank you. So if I get the question right, is the stem cells and how it contributes.
Yes,
right?
and particularly in the context of the UAE, what is the UAE striving to do in that context? A lot of that research has been happening for a while, the Genome Project.
All right. So let's go back a little. I mean, if I go backward and I say innovation is such a fancy word. I used to see innovation as something that, honestly, when it came out and everyone was talking about it, I didn't understand how to contextualize it and put it into real terms. So when we speak about innovation, and then we speak about, let's speak about particular part here, which is precision medicine. So we want to put this into the right context and how to make it kind of digestible for people to understand. As Shaista was saying, everyone has a different kind of ideas, and it's all about the definition, what I understand, what you understand, and so on. So going to the 4 Ps, where we predict, we prevent, we personalize, and we make it more of participatory kind of things to the patient. As simple as, what does the patient want? Quality of life. Someone with asthma, for instance, they just want to run. They're runners. How can we make their quality of life better? And then comes a vision in this country where the Genome project launched 2 years ago. The idea settled around 2019, where the leadership says, we need to know more about genome. So let's aim to sequence 1 million Emiratis. A lot of people were saying, what does that mean? Why do we sequence 1 million Emiratis? And I was actually one of them. I said, why? And of course, being doctors in rooms where we used to still give CDs to patients, we were saying, okay, we need this information to be useful in our medical records. And then I was, in 2020, there was an announcement of a council from the Ministry of Cabinet where Sheikh Mohammed bin Rashid announced the Genome Council chaired by His Highness Sheikh Khalid, where there's 6-7 ministers there, an expert, and the idea was, let's come up with a strategy. So starting with a strategy where we're going. And this strategy is not a strategy for today or for tomorrow. It's a 10-year strategy that focuses on prevention. Going back, people were saying, no, it's on, how many of you were saying, it's in your genes, you cannot change? A lot of us, if we said it's in our genes, that we cannot change. But no one touched on epigenetics. How can I stop the progress of something that is unwanted? Through lifestyle, through environment, through many factors. So the Genome program, where we sequence individuals to the 30x, the deepest sequence that we can get. And imagine in the next 2 to 3 years, all of this information will be embedded into your unified medical record, where a tailored approach in terms of medication, in terms of what biomarkers are linked to this and that, in terms of your outcome would be predicted and would give you a better outcome of what you came in for. We're very proud to announce one of the pilots that are successfully run by a group in Cleveland Clinic, Abu Dhabi, where we said, let's pilot the breast cancer pathway. And this is personalized. I'm going through to extreme to a cancer, but of course, we tend to want to prevent things 10 years before it happens with this program. So any patient with breast cancer will go into this pathway where a complete genetic test will be done, and then you incorporate the nerds, I would say, researchers, right? Who just looks at variation in one of the university. It was at this time NYU. And you create a path, and this helped us diagnose faster, target treatment faster, and giving a better outcome because the families who carries their gene now are being screened and they know what they are getting into. So we are catching prevention, we are doing the prediction, we're doing the prevention, and we are personalizing the treatment for the patient, and also let the patient know what they're going into. So covering the 4 Ps would give us a better outcome for our patient, and not only about patient satisfaction, this would be announced very soon. That will be the normal practice for anyone with breast cancer in the UAE.
Thank you so much, Dr. Farida. Dr. Sven, I think Shaista in her introduction talks a lot about this sort of primitive way of healthcare and how we move towards the future. And part of that sort of is we're starting to see new generation of healthcare systems globally. And Dr. Farida talks about this idea of personalized medicine as a big shift that we're finding. What are some of those disruptions that you're seeing globally, and to what extent have the region started, trying to track a little bit of this, and what does the future look like for you?
Well, that's a good question. If I knew the answer, I would be in a different business, I think. Longevity is the holy grail worldwide. And it's astonishing that for so many decades, we have not seen longevity as a theme that providers around the world are pursuing, and payers are pursuing, because payers should have an even more core interest of achieving longevity. If you look around the world, longevity is a theme, I would say, which came up the last 5 to 10 years. Is really something prevalent. And why is that so? Because it reaches into healthcare, I think, instead of sick care. Everybody is focused on sick care. All the money that society spent are going into sick care. Nobody really wants to have any engagement in healthcare because the payment system is not in place, right? And this is now being broken. We're now moving into a field where the consumer is becoming more kind of interested, more engaged in understanding more about what they can do for the ultimate goal of growing old. Although it's interesting, if you ask people how old do we want to be, many say 75, 80, it's always been like this. But if you then talk to 75-year-olds, the question is answered differently. So there is a keen desire actually to push what is possible. When we see what happens in the longevity space, it's typically 3 different things you can do. The first one is, I would call it avoid dying. That's what PureHealth is doing, right? Better clinical care with your help in getting kind of the right treatments to the right person. That takes you to 85. Then there's a second group of things about tickling more out of the engine, the nutritional supplements that you want to take to maybe get 2, 3, 4 more years on top. And then there's the real holy grail, which is about cellular intervention, which maybe the stem cell research is contributing to as well. Can't we be 150? Can we be more than that? That's the ultimate holy grail. Not operational yet, but that's the dream that everybody has. So when we see around the world what's happening in the space, longevity is typically a topic which is currently catered to the rich, I would say. A couple of clinics, you can look to Dubai, they are there. Around the world, you see clinics who are, for a lot of money, trying to kind of furnish the dream of getting there. But we don't believe that's the way to go. That's just a bit of marketing and branding in place. The real kind of drive into longevity will be the integration of data, as my 2 previous speakers have mentioned that. Bringing together everything we know about ourselves, integrating that in a way that is meaningful for us as individuals. Personalized medicine in the truest sense of the word. Most of you have Apple Watches, Apple cell phones that give you information on steps taken, on heartbeat, all of these things, but they are quite frankly meaningless for most of us because they don't tell us anything about what we want to do. The next big step is going to be that translational step that PureHealth and others can drive of bringing together all that information into a kind of a biological clock, where every single one of us will learn what do we do for our longevity. Yeah? How is our behavior going to change? Only if we have that metric, that one metric, is behavioral change really possible? Because that's the toughest thing to do. If I can share a secret with you how you grow older without Shaista, sorry for that, it's 4 things, right? Low-calorie diet, intermittent fasting. Thank you. You're welcome. Intermittent fasting. It's non-inflammatory nutrition, and it's moderate sports. If you do these 4 things together, you can tickle another 15 years out of your lives. There's this book about blue zones where this already happens in reality. Basically, that's the basic principle behind it. Sounds very simple. It's super hard. Because what does non-inflammatory nutrition really mean? It means no fun in your life anymore. Nobody wants to do that. We are dreaming about this pill. In reality, that's the tough job to go. And you will only go that journey if you have something that measures, is this really going to help and contribute? Because the scientific evidence, how much we can get out of such tough behavioral change is very low right now. So there's a lot of kind of hope now in providers to actually make that step and engage into generally healthy people, to get that information out before they turn sick. and they can do something about it. If you move a person who is slightly overweight into a normal weight person, the healthcare system saves 20% of costs. That's a well-established number. That's where we want to go, but to get there, we need personalized approaches.
Thank you so much, Dr. Sven. I think you mentioned a lot of the points on data, as a big one, and using sort of wearables and other elements. And I think, Shaista, also in your introduction, you talk about the future of digital tools. This is a common question for all three of you. We often, when we talk about the new wave, and you started by talking how other industries have picked up on tech and AI and all of those technologies a little bit faster. For each one of you, what excites you the most in terms of this AI and digital biotech revolution? What would be this one thing that you're so hopeful would be transformative?
I'll start, if you guys don't mind. Yep. So first of all, I think AI is as important to longevity as water is to man, or for coffee is to Shaista. So that's how important it is, and let me explain. When you want the best kind of healthcare, you see, you want to find out what is the best way to lead your life. Mona, you would go to see a physician, or a health coach, or a mental health coach, whatever your requirements are. You'd go, you sit with them, you'd get your guidance, and time after time, you'd check in with them as frequently as possible to see how you're doing. Now, we can't pair off the entire population with a physician. That's too many physicians for the planet, right? What can we do? We can have AI. AI-enabled engines that will run your data and will enable you to have that personalized life coach on your phone, which is integrated to the Internet of Things, your Alexa at home. It's integrated to your wearables. If you've got a Skinnables, you've got your smart fridges, it's integrated, and it will give you a holistic approach. It will capture all of that data, run it faster than any human being can run it, and tell you exactly, Mona, you've had too many calories today, better cut down. Mona, do you really want that tiramisu? Or Mona, you didn't exercise today. Or Mona, you know what, there's something wrong. You're not laughing as much as you used to. So do you want me to get you in touch with a mental health coach? And that's only possible through AI. I agree with what Dr. Fatima said, with what my friend here said, is that it's actually quite simple. Now imagine if you arm that AI with the genetic sequence, with all of that data of every human being. It would predict your entire journey, and it would make sure that you live your life to the fullest, to be happier, healthier, you live longer lives. 10 years ago, we had 25,000 healthcare apps. Today, we have 350,000 healthcare apps. What are you going to do? Download all of them on your phone? You want something to make sense of all of that data, to be that one single master app that takes you through your healthcare and life journey, and that's powered by AI. Thank you.
I'm not going to add much to what Shaista says, but AI, unless we develop a different brain, then we will not be able to comprehend. I don't know, maybe in Abu Dhabi stem cell we can, I don't know yet. But saying that, with all of this lake of data, machine learning is essential. Machine learning is going to, accelerate the process 1,000 times more into what we want to happen. For instance, now, when it comes to pharmacogenomic, or it comes to a certain protein that we want to make that would tackle a certain problem. I don't know if you all heard, recently an MIT group has come up with an AI system, came up with a very new protein structure, 3D structure. What is this? It tried a lot of data lake, obviously, to come up with this structure of protein that is there. This tells you, this is just a key. In the future, we will be able to identify the 3D structure of certain proteins that prevent diseases. And this is like way ahead. I'm not saying way ahead. Let's take medicine away. Have you all heard about the Chat GPT? Anyone here heard about it? Okay, so Chat DALL-E. Now marketing and infographics will die soon because all of these exist in a platform where we can log it in because of artificial intelligence. So artificial intelligence is a question to take home today because I don't have the answer. Should it be regulated? Because till now it's not regulated. So this is just a question for the audience.
No, just I cannot disagree with what you said. AI is going to be very important. I mean, specific applications, something like drug repurposing, where historically labs would have used decades to find what other users are there. Nowadays, you can do that in a AI environment. Beautiful benefits for, especially for rare diseases. I would say on the biotech side, genomics is what I'm most interested about. And genomics for the whole group behind it. So microbiomics is also something which is already very advanced. I think they've reached a point where the practical applications are tangible. And I'm saying that because I've done my own whole genome sequencing. And then you get a nice analysis of 300 diseases and your propensity towards them. And you start looking at the one with the 1% and stuff, that's really nice. But then there was 100% on glaucoma. I didn't even know what glaucoma is. It's an eye disease where you have too much eye pressure and you turn blind when you go old. Went to a doctor, and that's now the bottleneck in the whole system. You show a genomic report to a doctor, you speak for 10 minutes about that your data is now in China and they're building a twin in China from you, right? That's the feedback my doctor gave me right away, and all the doctors, until she finally saw the pictures taken of my eye and she could see that the prediction was correct. I think that's the future. AI applied towards identifying more in the genome. Maybe 2 or 3% of the genome understood today, 97% are still in the dark, but that's going to be an area for PhD theses the next 15 to 20 years to actually find more insights and personalize the advice. Bringing it together with your behavioral information, again, into this one biological age information, I think that's where the future is going to be.
Thank you so much, Dr. Sven. I'm looking at the clock and it's making me very anxious because it's becoming red. And so I'm very conscious of time, and I would love to open it a little bit for the audience. So if you have any questions from the audience.
No? Okay.
We have one here. Just 1 sec. Let's grab the mic. 1 second. Give me. All right. Our very own Ramya. Here you go.
Thank you, Amar. Thank you, Amar. I would like to ask the question about solutions that are accessible to the masses. So we're today speaking primarily about solutions that are available for the upper echelons of society, people with wealth. So what are the most accessible solutions for people who are not necessarily in that category? Thank you.
That is a very good question, because as we speak about technology, and obviously this is something that costs a lot to build in, there is all of these gene therapies that comes out costing millions of dollars that certain people can afford. I'm sure that you all heard of the new also diabetes medication that is for prevention and how much it costs. So saying that, we are, as a government, there is also some sort of humanity. What do we give back to humanity? And of course, everything was evident from the vaccine and how the UAE contributed to make it accessible as much as to all the countries who are unfortunate to have it. Saying that, I'm going to speak from a perspective what we do in Abu Dhabi Stem Cell Center, which is under PureHealth. One of the therapies that called CAR T therapy, where you basically take the immune cells, re-engineer it, and bring it back for certain type of cancers. So we're successfully, we did a 3 kind of experiment where we successfully grow them. And one of our aim is to make it affordable and accessible to certain group of people. So this is one initiative, I know, but I think we need collaborative effort from everyone around the world to look at it in a different way, because at the end, if we don't have commitment and collaboration, this will never happen. So this is just an example, and I think this needs a different panel and maybe much time to answer this. Thank you.
I think you raised the right point. I think on the diagnostic side, I think that was the beginning of the question. It's getting cheaper and cheaper as we speak. So a whole genome, you can get it sequenced for $199 with lifelong reports, another $200 on top. And you're taking, so that's I would say is now achievable for the mass market. I think the concern is the cure side, because the more we move into rare diseases, the more rare diseases we will identify, and the more expensive it will get to cure those. And if you talk to health insurers, their biggest concern is indeed the growth of the cost for genetic therapies in the next 10, 15 years. So I think that's where societies will have to make choices, most societies, between kind of financing traditional care versus financing maybe life-saving care for some rare conditions.
Sure. So my name is Hinda Dagag. I'm the head of genetic projects at Saha Corporate. I was wondering if you can perhaps touch upon the topic of education and raising awareness. We all know that obviously technology is moving at such a high speed, and how do we ensure that we are ready for it from the perspective of the workforce? So from a clinical perspective, from the perspective of general population, schools, do we start incorporating genetic education earlier? If you can just kind of elaborate a little bit more on that.
So part of the strategy enablers is building the workforce. Of course, we know science outpaces policies, outpaces many things, and what we need to do is we need to catch up and keep up. So one of the things is, first of all, with partnering with the department and the regulators, Ministry of Health, Department of Health, this is one of the things that, in terms of their requirement, jobs are created. So people are looking forward to go into these fields now. From academic perspective, we encouraged a lot of universities with incentives from the government to open courses and master degrees and everything in regards to genomics. Starting in schools, we already have an agenda that will be published next year for schools, how it's going to be incorporated into science festivals, into the curriculum, and also there will be a hackathon coming for also talented kids that can be participating on. So and again, not only this, the counselors in the hospitals or the healthcare workers, we're looking into, since telemedicine and virtual medicine is something that COVID blessed us with. This is one of the ports that we will be utilizing as a centralized service, that there will be an access to counselors for each patient, because we are going so fast into sequencing. We need an answers and we need experts in the field. So it's stacked from, as per the strategy, from few aspects. Hopefully within the next 2 to 3 years, we'll be having proper projection of how many estimated is to get out from these programs that the government's creating.
I'd also like to just add one thing on this, Hinda, is actually 3 comments. One, when you talk about healthcare, there's a community outreach, correct? Then how you actually make noise about this or educate this is through the physicians. That's the second way. The regulator obviously is going to help spread the message around. I'll come to the third and the most important one at the last. But the first one, community outreach, we're already planning with the Department of Health, with the right channels, where we're spreading the word, educating people on the right metrics, on the right requirements, on how to live their lives, and the importance of genomics, right? There's a lot of misconceptions out there. If I get a whole genome sequencing done, I'll know how I'll die. That's a common one. No, you're not going to know how you die. You just get a risk probability of everything that you need to watch out for. Second is physicians, our mindsets. So you have physicians still, which are within our healthcare ecosystems, which are still living in the 90s. And how do you change that mindset? And that's something which is going to be gradual. And that's one of the major reasons why we've not been able to catapult ourselves towards the 4th IR, right? And the third, and this is a private joke, stop eating tiramisu. Thank you.
I agree. I think it's continuous medical education for your physicians, incorporating new technologies into pathways. There will be new job groups, longevity counseling, if you want, to help physicians and patients, or citizens, I have to say, they're not patients yet, to understand what's going on. And I think third is also you need to have a couple of public role models to actually suggest to all of us that it's a good thing to inform yourself about your own health. How did consumer genomics come to life? Because Angelina Jolie in the teens was stepping forward because she had identified the BRCA gene, which was deep in her family, also in herself, and she undertook the drastic actions to kind of prevent the cancer from ever breaking loose. That was the beginning of consumer genomics in the US. We need that kind of role model behavior also from public figures.
Thank you so much for all the interventions. We've reached the end of this panel. I have like, even the flickering stopped on the time, but it was wonderful and very inspiring discussion. Thank you so much. A round of applause for our amazing panelists. Thank you so much.